Bienvenidos a los que se han unido recientemente. Mi nombre es Perla y soy la vicepresidenta de LatinX L.I.F.E, una organización sin fines de lucro de justicia social que empodera a los latinos para seguir una educación superior y cierra la brecha entre los recursos comunitarios. Esta noche estaré facilitando una charla sobre la desconfianza médica en las comunidades hispanas, latinas, negras, morenas, con énfasis en la vacuna COVID-19. Cenzontle le ofrece la interpretación en inglés esta noche.
Hi, everyone. Welcome to everyone that has just recently joined. This is Perla Fuller, the Vice President of the nonprofit LatinX L.I.F.E that strives for social justice and encourages higher education for Hispanics to bridge the gap. We will have interpretation by Cenzontle Language Justice Cooperative tonight.
You able to hear the English channel now, Don? Hello, everyone, and welcome to this webinar. This is a bilingual space that has been brought to you by Cenzontle.
Welcome, everyone.
Hello, everyone.
This is a bilingual space brought to you by the Cenzontle Language Justice Cooperative. Como sabemos, nuestros movimientos son multilingües y se requiere un compromiso de todos al crear espacios.
As you know, our spaces are multilingual.
And it takes everyone's commitment to create multilingual spaces. Entonces, ¿cómo podemos practicar la justicia del lenguaje juntos? How can we be in language justice practice together? Primero, recordándoles que hay un solo micrófono y solamente podemos interpretar por una persona a la vez. Just remember there's one mic and we can only interpret one person at a time. También nos ayuda mucho si silencia su micrófono cuando no esté participando. Ayudará mucho para quitar el ruido de trasfondo. Also, it's a lot of help if you mute your mic whenever you are not participating. This will minimize the background noise. Les pedimos también que hablen en voz alta, fuerte y claro para escuchar su mensaje. We also ask for you to speak up loud and clear so we can hear your message. También es de mucha ayuda si hablan despacio a un ritmo más lento o moderado. Also, please slow down and speak at a moderate pace. También ayuda mucho respirar después de cada frase, pausar al hacer preguntas o cuando cambia la persona que está participando. It's also helpful to take a breath after each sentence or pause after asking a question or when there is a switch in speakers. Si hay algún problema con la interpretación cuando esté ya encendida, que les daremos unas instrucciones aquí por Zoom. Si están teniendo algún problema, déjenos saber inmediatamente. Escriban un mensaje en el chat, ya sea una de las intérpretes o a Natalie Marshall Rodriguez. If you're having any issues with the interpretation once you have turned it on, we will give you a few instructions on how to do that. But if you experiment any issues after that, please let us know immediately. Write a message in the chat to either of the interpreters or to Natalie Marshall Rodriguez. Para acceder a la interpretación se verá de dos maneras distintas, dependiendo si está por computadora, será más como la mano izquierda, y si está ingresando por teléfono inteligente o tableta, será como la mano derecha. Si está por computadora, entonces si va al inferior de su pantalla, verá la barra de menú, ahí tendrá un globo que dice interpretación. Una vez que le dé clic ahí, tendrá tres opciones: modo apagado para la gente bilingüe que puede escuchar en ambos idiomas, inglés y español; inglés para las personas que solo quieren escuchar y participar en inglés; o español para las personas que solo quieren escuchar o participar en español en esta llamada. Y después, si están en un teléfono inteligente o tableta, se verá bastante similar, pero tendrá que ir al lado derecho, al inferior de la pantalla. Verá los tres puntos que dice más. Una vez que le dé clic ahí, tendrá la opción de interpretación de idiomas y después las mismas tres opciones: audio original para bilingües, inglés o español. Escoja el idioma en el que se sienta más cómodo y después ponga finalizado y tendrá la interpretación encendida. So how to access interpretation? It will look like two ways depending if you're on a computer. It will look like the left-hand side. If you're in a smartphone or tablet, it will look like the right-hand side. If you're on a computer, if you go to the bottom toolbar on your screen, you will see a globe that says interpretation. Once you click there, you will have three options. The off button for bilinguals who can listen and participate in both English and Spanish. The English language if you would like to listen and participate in English only for this call, or the Spanish if you'd like to listen and participate only in Spanish for this call. Similarly, if you're on a smartphone or tablet, you will go to the bottom right-hand corner. You will see the little three dots that says more. Once you click there, you will see the language interpretation option. And once you click there, you'll have the same three options: original audio for bilinguals, English, or Spanish. You choose the language in which you feel most comfortable, and then you hit done, and you will have the interpretation enabled. Muchas gracias a LatinX.
Thank you so much to LatinX L.I.F.E and the Public Health Department of Rockingham County for making this a bilingual space.
L.I.F.E and the Department of Public Health from Rockingham for having us here and having this available bilingually. Thank you so much.
Muchas gracias a ustedes.
Thank you all. Introducing our community partners. Katrina White from the Department of Health and Human Services of Rockingham County, who made this event possible. She will introduce our collaborators. Go ahead, Katrina. Your mic is on silent.
I'm not sure if that was translated. Katrina, were you able to?
Can you hear me?
Yes.
Okay, great. Hello, everyone. Good evening. And on behalf of LatinX L.I.F.E organization, NC 100, Roll Forward, Reidsville Area Foundation, and the Rockingham County Department of Health and Human Services, we would like to welcome you to the Medical Mistrust Forum. As we all know, COVID-19 really shed light on the inequities in our county, with health being having the most devastating effects. However, what COVID-19 also done is galvanize us to create platforms to allow us to participate in these discussions. And it's sometimes very difficult discussions, but they are discussions that need to be had. We will talk about the importance of everyone getting fully vaccinated, how and where you can get vaccinated, and the Bring Summer Back campaign, and hopefully dispel some of the myths that you may have heard and answer some of the questions that you may have. We have a wonderful presenter tonight, and without further ado, let's get started.
Gracias, Katrina. Ahora me gustaría
Thank you, Katrina. Now I would like to introduce you to the doctor who will be presenting this evening. Dr. Luz Juliana Barahona was born and raised in Colombia. She moved to Florida in 2001, assisting Florida Atlantic University, where she earned her bachelor's in biology and minorities in literature, Spanish literature, and Latin American literature. She attended the School of Medicine in Puerto Rico in 2006 to 2010. During her education, she had the opportunity to work with patients with cystic fibrosis and patients with other sicknesses like that are pulmonary, chronic pulmonary diseases. What awakened her desire to follow in this career, centering in the long run on patients with chronic illnesses. She finished her residency in internal medicine and pediatrics, and she has grants in pulmonology and pneumology. And she also has work at the University of Miami-Jackson. Dr. Barahona lives with her family in Kingston, North Carolina, where she is currently the the chief of the pulmonary division of UNC Medical Center in Lenore. Her areas of interest are attention and for children and adults with chronic illnesses, defense of patients, and more recently, the prevention and treatment for COVID-19, and also the access to medical care in rural communities. During her free time, she enjoys time with her family and to go on road trips to learn more about the beautiful state of North Carolina.
Muchas gracias por tu introducción.
Thank you for your introduction, Perla, and thank you to all the people who made this space possible, where we are able to talk about the illness of COVID-19 and the vaccines and respond to the questions that could cause doubts about the illness or the vaccines, and also to facilitate vaccination for our Latino community. Thank you. Thank you for being here. In preparation for tonight, there was a survey that was carried out in the over the couple of weeks, and we received 128 responses from African Americans and Latinos. Their responses influence the way that we're going to be leading the session today. As Dr. Barahona brings us her experience, you as participants can ask questions through the question and answer function of Zoom. And questions and answers, question and answer section is on the lower part of your screens. And you can use also the chat, which is also in the lower part of the screen. So now, my first question, and these are based on the questionnaire that we carried out. What do vaccines do? How do they work? And how many different types are available? You're on silent, doctora.
Creo que todavía está en mute. Lo siento. Eso pasa.
Okay.
Oh, okay. Gracias por la pregunta. Thank you for the question. At this moment in the world, there are 4 types of vaccines. In the United States, we have 2 types of vaccines, 2 of the 4 types, and 3 different vaccines. 2 are related to a vaccine that is called an RNA vaccine. And this is a vaccine that uses and there's another one that uses the vector viral. The vaccines that are made of RNA messenger are Pfizer and Moderna, and these vaccines require 2 doses. The vaccine for Pfizer requires a dose and then a second dose 21 days after the first vaccine, approximately 3 weeks after. And the Moderna vaccine requires a dose, and then 4 weeks later, we have the second vaccine. These 2 vaccines are made with a message that the vaccine, it brings into the body, and the person who receives this vaccine, the message, what it says, is how a protein can be on the surface of the virus, and this is the protein spike. And so it's the protein is covered in a surface of fatty substance. And so when you give the vaccine to the person, the protein is grabbed by the immunological system, and this cell starts to produce this message, and in this way immunity is created within the body because the cells are acting like police in the body, and once a person becomes ill with the virus, the message is there and it knows how to fight against the virus immediately. The other vaccine that's available in our market is Johnson & Johnson vaccine. This one is made with a viral vector. It's not COVID. It's a vector of a virus, which is called adenovirus, and it does not cause an illness. And the person who receives it, it is created in this way so that it will be a carrier of the protein spike, and in this way that makes the message is replicated in the same way, and person who becomes ill, the body will respond quickly. And as you can see, neither of these vaccines are made with virus from COVID-19. It's impossible. There isn't any way that the vaccine could produce the illness. In other parts of the world, they've used deactivated virus, but in our market, we do not have any of those vaccines. And for this reason, the vaccine does not contain COVID and it doesn't give you COVID. These are the type of vaccines that we have. I don't know if there's another question in this respect. Thank you. This is very interesting, as you indicated, that it's like a police, because the body knows how to respond. And this gives me a vision of how it works in the body. And it's one thing that we hear a lot, that if you haven't gotten it, it's going to give you COVID. So it's good to explain this and get rid of these concerns that people have, because many people talk about how they have fear about getting the virus. The second question is that we know it's not a secret that Latino and Hispanic community were very affected by COVID-19. These communities also reported lower income and lack of medical insurance compared to other racial groups. 17% of the people who responded to this survey believe that residency and citizenship are important in relationship to the vaccine. What documents do you need to have in order to get the vaccine? And do you need to have insurance? Thank you for such an important question, because we know that it's not necessary to have any kind of documentation or to have any type of insurance. You don't need to have money at all because the vaccines are free. So I want to say that these vaccines are already paid for. It's paid for by the taxes that people of this country pay. And part of the money from taxes was destined to the research and the purchase of the vaccines. And so these vaccines are already purchased. Nobody is going to charge another person for the vaccine. And if this happens, we need to make a demand. We need to speak about this, because it's a misuse of the vaccines, because the vaccines are not for sale. They're completely free. Now, in the chat, I have put a link to the page of the CDC, which can show us what are the requirements. Excuse me, it's not to say that. It's from the Department of Health of North Carolina, not CDC. And I'm going to read it literally what it says here. It says that the vaccines are free in all parts of North Carolina. You don't need identification from neither government ID or a license in order to receive the vaccine. And in some places, it may be necessary to make an appointment. maybe you'd be occupied, or maybe you have to go. Maybe they need you to make an appointment, but they are never going to ask you money, and nor are they going to require identification or not your papers, or maybe a telephone number or address in order to give you the second vaccine. But this has nothing to do with your immigration status or anything else. There are a lot of people who are coming from other countries in order to get the vaccine because there isn't regulation to say this is from here or there. But this should make our Latina communities more confident that the vaccines are free and they're not going to be pursuing anybody who has received the vaccine. This is very, very important. And it also says on the website that all people can be vaccinated regardless of their immigration status. In no moment can they deny you access to the vaccine or to pursue you because you've gotten the vaccine. This is very important, especially if there's anybody in the audience who wants to receive the vaccine. And so they could make a demand, but people, as Dr. said, in North Carolina, these are the rules. So it's perfect. Katrina said that they need to fill out a form of consent for the vaccine, but this is also, this doesn't ask anything about legal status or your social security or any documents like that. And maybe just a telephone number, your address, and maybe this is necessary for consent or to say, yes, I do want the vaccine. I give you permission to give it to me.
The next one is that 83% have confirmed that they know someone because they didn't get a vaccine because of religious reasons or cultural reasons, and 70% of the people have heard or known someone who had grave side effects. And so how can we answer these questions for the people that might be hesitant to get the vaccine because they have some cultural or religious beliefs or have seen bad reactions to the vaccine? Okay, so the first question might be the hardest, because if culturally or religiously they don't feel like they should take it, then that's very hard to say, okay, you have to take it because it's a public health matter. It's not only to protect yourself, but to protect others. It would have to be a one-to-one conversation and know what the roots of this cultural belief or religious belief, and we don't have to be violent about it, but just try to explain that this is something that has developed for the well-being of humanity. So it would have to be a little hard to think of a religion that doesn't want the well-being of humanity, but maybe on a one-on-one, we would have to see what this religious belief or cultural belief is, so that we can try to manage it in the best way. And I would like to say to unroot, but you can't. The religious beliefs and cultural beliefs are so important. I understand it, and I've seen too many cases and too many people die due to this virus. So I don't think that any religion or any cultural belief should attempt to someone's life. So since this is a disease that can cause death, or a disability on a person that can be severe, as being in dialysis permanently or being on oxygen permanently. I don't know that there's a belief that can cause for someone to say that they shouldn't get vaccinated and to expose themselves to so much risk and pain and disabilities. But we would have to do it in a one-on-one, because it would be too broad of a question to respond right now. But I mean, I am available to talk to people about this if it's needed, depending on the case. And then when people say that they have a serious reaction, no one wants to feel bad, right? And then if it's a matter of having some type of reaction to the vaccine and someone doesn't want to feel feverish or a headache, that they can think about how that can be a severe reaction. But most of the people that have a reaction to the COVID-19 vaccine has been a reaction that clinically is considered light or slight, because having a little bit of fever and a headache or muscle ache for 24 to 48 hours in the medical term is something that is light. There's very few people that have experienced a grave reaction. A grave reaction would be those who put the person's life in risk. It would have to be someone who have had an allergic reaction to another vaccine or some other medicines, or who are extremely allergic. And these people know who they are because they have had some other type of incidents in their lives before. And as Katrina was explaining yesterday, every entity that provides the vaccine is prepared to attend to a severe allergic reaction with epinephrine. And every center that is giving these vaccines require for the person to stay after being vaccinated from 15 to 30 minutes, because the severe or grave reactions usually happen in that span of time. So in that way, the medical personnel makes sure that the person will be fine. It may be that you will have some pain on the site where you got the vaccine and maybe a little bit of discomfort after the vaccine. But what I like to say to my patients and to the people who are listening to these talks is that this is not something so bad. It's worse to be sick with COVID. And in the medical sense, it's something that is almost desired, because what it says is that our body has begun to create the reaction and create the antibodies that are needed to fight off the virus in case we get the disease. That's why this happens. That's why people feel bad after the second vaccine or the second doses, because they've had the first doses and the body was preparing, and then when the message was given again, the body is getting a reaction, but it's making a reaction and then understands that it's just a message, and so it only lasts 24 to 48 hours. This is basically what a person can expect after being vaccinated. And then I will put in the chat, I also have a link to the CDC and the secondary effects that the people can expect, which are, as I said, fever, chills, fatigue, pain where you received the vaccine, a little bit of local inflammation, headaches. Some people may have vomit or diarrhea and muscle aches. But in general, this doesn't last more than 2 days. This is basically it. Thank you so much for clarifying that. A lot of people have heard, oh, I took it and now I feel worse. I don't know how I'll feel with COVID. And so they feel with a little bit of ache, but it may not be so bad. Thank you so much for putting the link there too. For those who would like to see more about the symptoms after taking the vaccine. I have also heard that people may not feel anything. That's true. Some people may not. So there's also lots of rumors and myths and fears that have circulated on the web in respect to the vaccine. We would like to discuss some of these myths, just like some of the ones we've already heard about, so that people can take the safest option for them and for their loved ones to get a shot. One is fearful that the vaccine was rushed and it may not be so safe. And so they're like, why would I take this vaccine if they developed it so fast and other vaccines developed so in so many years? Thank you so much for this question. This question is a very interesting and important question. There's many reasons why the vaccine has developed so fast. And more so, we should be thankful that it was developed fast, because we can then have the results in such a short time, because the world was dying. Everybody in the world were dying. And so this was an effort from the scientific community in the world. It's not just something like my patients say, oh, Bill Gates designed it. No, no, no. Bill Gates gave some money, but he had nothing to do with developing it. It was more intelligent minds, the best scientists in the world were in their labs, getting together to be able to develop this. That's the reason why it was put out so fast, and there's various things and reasons as to why it was rushed. And of course, all the economies were being affected. All the countries were affected by the sick and the dying. And so a lot of money was dedicated. As we know, Bill Gates and the private community and the governments invested a lot of money in this analysis. And where there is analysis, there's more people together, more resources, more brilliant minds together. And that's why one of the reasons why it was developed so fast. And then the second thing that happened was that the time was shortened. So it was shortening time without compromising the safety of the medicine. So what sometimes there has to be lots of presentations done and lots of meetings done. They expedited that. But the other thing was that the vaccines started producing. When you make a vaccine, there's 3 to 4 phases to make a medicine, not only vaccines, but other types of medicine. So in the first phase, it's only a few people, and then we see if the vaccine is safe, if the medicine is safe, so that no one's going to have adverse effects that are horrible or death. So once you see that that medicine is safe, that the community, the scientific community say it's safe, then there's more phases where it involves more people, and then you start seeing not only if it's safe, but if it's effective. And then in that range of time, when we have seen that it's safe and the scientific community sees that it's safe, then we start seeing that the pharmaceutical companies start to manufacture it. If it's effective, at least we are ahead on the production. And so the ones that were effective kept the production from early on, and that's why it was easy to access them at the time that they were approved. The other thing is that the COVID virus has other cousins that we've seen. The other SARS, which was in Asia and caused many deaths. But then we also saw the cousins or the siblings of this virus, which were violent and we had known. And so having these other viruses and knowing how they work, and then the structure helped us to be ahead on the analysis, and that the coronavirus, COVID-19 is new, but the coronavirus family is broad, and we already knew about some of them, so that's why the investigation was done quickly. And then we live in a world where, whether we like it or not, it's very communicated. So all of the labs here in the US, in England, Germany, in China, everybody was in communication. And once a lab advanced, the whole world advanced. So this global communication helped us to develop this faster and easier. The other thing is that vaccines, just like the ones developed, the RNA messenger, it was therapies that had been used already for cancer treatment. And so these was able to achieve the fact that we kept developing the vaccine, and not to begin from zero, to begin from a point where we could advance and were able to achieve this vaccine in a short period of time, between 8 to 10 months. During the first studies, 43,000 people were vaccinated, and from those people, they gave such good results that we approved the emergency use in other countries before the US. So yeah, it was fast developing, but the reason of this is that it's not that it was done recklessly, but because we live in a world where we have the technology to do this. So how do we think right now, if everybody had the opportunity to buy a Tesla or a Cybertruck, because, and I say this because my son is obsessed, and he's only 7, but they say, wow, that's a great car. How far we have come, right? How we developed it this way. And we feel admiration, but the way that we developed the vaccine, and instead of having the same admiration and thinking about how we've advanced, we start saying, no, that can't be good. But if we put all of our bodies in the car, and we go with the risk that this may represent, but then with the vaccines that are made to save lives, we have so many questions and so much mistrust. And I think it's something that was done to save the world's life, and it's working. The numbers have improved, and the number of deaths have decreased, and the number of people who were severely affected have also decreased.
Muchas gracias por desacreditar los mitos y brindar conocimientos como profesional, y también por estudiar la evidencia de como los números, como dijo.
Also for talking about the difference and using this example of the car. And now we have a question. Please feel free to put a question in the chat, and the question in the answer area, or raise your hand. You can press the button to raise your hand, and we will activate your mic so you can ask a question. Or you can use the chat where it says questions and answers, and we'll be checking there as well. And to add to this, Perla, if I may, in the question and answer portion where it has a Q&A, this is for making anonymous questions. We're not going to know the name of the person who asked the question. So if you have a question that you don't want to be associated with your name, thank you for adding this so people can feel more comfortable. And that way they can know that it's anonymous. Any question is important. And on the screen, you can see where somebody has raised a hand, and you can do it through question and answer, or you can do it with the chat. As we wait, I'd like to add a few more things, if I may. Based on what I've heard from my patients, my mission, of course, is try to keep my patients safe and healthy. And the way that I do this is I've seen this in my personal experience, firsthand experience, is the use of vaccines. So some people have asked me if there are heavy metals in the vaccine, if this is going to cause problems, health problems in the long term. Perhaps if they have allergy to eggs or to latex, can they receive the vaccine? These, and also if it has a microchip, or if there's a type of device, some type of a device that could cause an ability to track you if you receive the vaccine. And the CDC link that I share with you are all of the components, all of the ingredients that are active and inactive in the vaccines. And none of these has egg, none has latex, ningún has gelatin, none has preservatives that are noxious for health. They are made primarily with the message of the RNA messenger, the lipids, and it's a tiny quantity because it is the way that the RNA messenger is wrapped up so it doesn't degrade when it enters into the body. And salt, that's all. There's nickel or cobalt or lithium or iron. There's no electronic apparatus or microscopic or any type of nanowires or any of these types of items that we've heard that unintentionally somebody has put this out there on social media and other platforms, and it has created a tremendous amount of fear in people. As I said, this was a worldwide effort. This is not the question of a private individual trying to do this for their own benefit, because everybody in the world, in all of the countries, we are receiving the very same vaccines. And this doesn't have any relationship. If you go to the clinic and you have the Pfizer, maybe they have Moderna, you can go to one place or another in Colombia and receive the vaccines. So there's no pattern that is possible to have this clarification for you, especially young people who are giving themselves over to Instagram, TikTok, and and false information that you gave the vaccine, now you're going to be a robot. They're gonna follow you. I've heard this a lot, especially from young people. They don't want it, or because they got the vaccine, their friends knew about them. All of these myths. So thank you for explaining this. Because there are also adults who feel this way, or they're waiting more time to see how others respond. Waiting and waiting. We have a question from Esmeralda. Are there more studies about how the vaccine will affect babies of women who received the vaccine while they were pregnant, or they're breastfeeding? So will they be immune to COVID-19? There are no big studies in relation to this, but in medicine, when we can't think that in this moment we're going to have 100,000 women who are going to be pregnant and give them follow-up, but it's very important, and it's something that I've tried to investigate in order to understand for my own health and for the health of my patients. During the trials of Pfizer vaccine, there were 243 women, 243 women who were pregnant or who became pregnant during the study. And of these, 124 had normal children who were healthy, and the others who lost their babies were normal losses that couldn't be related to the vaccine, just what happens in the pregnancies. There are cases where they've taken the baby's blood and they have demonstrated that they have some antibodies, but there's nothing that says that this is going to happen 100% of the time. We don't know at what point after having received the vaccine, the immunity forms and is transmitted to the baby, to the fetus. But there have been some cases that have been published that demonstrate that the mother's immunity, what she got from the vaccine, has been transmitted through the placenta to the baby. There's another question about pregnant women. Can pregnant women get any of the 3 available vaccines, or is there a preferred one over others for these individuals? All of the vaccines that are available are fine for any pregnant woman. Now, obviously, we have 7 cases amongst 1 million, which is something very, very small, but it's important to say it because this is a space to receive clear information, and this is what I want to give. There was a case that's been in all of the news about Johnson & Johnson, where women between 18 and 15 years of age had problems with a rare illness where blood clots were formed and that go to the brain and cause a stroke and other types of illnesses of this type. So this is what I need to say. I don't want to say that I'm discrediting the vaccine of Johnson & Johnson. They've put it on the market for the benefit overrides the risk of the vaccine. And as I said, it's a risk of 7 people who've demonstrated these symptoms out of 1 million people. And this doesn't include or discard women who are pregnant. But this is what was seen when they did the study of an analysis of these studies, of these cases. They were women who are 18 to 50 years of age. So this is just to mention, but it is not that to say that a pregnant woman who receives the vaccine from Johnson & Johnson and the other vaccines, as I mentioned, are women who are pregnant and they participated in the studies during the early trial phase, and they have had healthy babies.
Okay.
Tal vez haciendo a veces las personas se sienten más confortables de hacer su propia.
Sometimes people feel more comfortable making their own investigation, and they feel more comfortable with one or another, perhaps. Thank you for this. I wanted to mention it. And also, Katrina is mentioning in the Rockingham County Department of Health and Human Services, they are giving vaccines to pregnant women, but you do need to bring consent form from your doctor, indicating that you talked about it with your doctor. In the event that you want to go to the Rockingham Department of Health and Human Services, you would need to bring this document with you. It's a requirement. Thank you. And why would you need consent from your doctor if it's approved for by the doctor? This is directly with the Department of Health. I don't really know why you would need that. Maybe, I imagine, that it has to be something based on a conversation that how do we respond to the questions? But maybe Katrina could say more, and she could say it in English, and I can translate it.
Hi, Dr. Barahona.
Hola, Doctora Barahona.
Hi. Yes, that is just something that is protocol. This is based on state and federal requirements of the United States Department of Health and Human Services, as well as North Carolina Department of Health and Human Services. It is just something that's going to be pretty much serve as a standing order and a practice that we are all, as health departments, there are 100 health departments in the state of North Carolina, and we're all practicing the same thing. Now, whether our department, another department in North Carolina, implement that, that is to their discretion. However, Rockingham County does respect that and want to make sure that everyone understands that. It's not that anyone has ever had a problem with providing the information in order to get that vaccination, but it is something we want them to make sure that they understand that is a practice of Rockingham County Department of Public Health. And it's a safety issue that protects the patient, the child, and our organization. Can you hear me?
Yes, the interpreters are going to do the interpretation. They have asked me to allow them to do it.
Oh, okay. I'm so sorry. I'm probably talking too fast.
Me too. No.
And I hope that answers the question.
Thank you. Thank you for that.
Okay.
All right. Bueno, entonces quisiera saber si alguien más tiene alguna otra pregunta.
So is there any other questions? I think it was covered more than we have covered all the questions that were most important from what the survey answered. So I don't know if anyone else has any questions. I don't see any questions, but there's an announcement from the health department. We will go do that. Let's see. Katrina, you have the announcement?
I do. Thank you so much. I just want to just let everyone be aware of the upcoming events that we have and what we're offering at the health department. Every Thursday of each week from 8:30 to 4:30, we provide the first vaccination for the COVID vaccine. On Fridays is pretty much allowed for or scheduled for people who are receiving their second dose. We are definitely enforcing and implementing the Bring Summer Back campaign, which is just a campaign that's just letting or just trying to help individuals understand that we've been through a rough 15 months and it's time for us to get our life back together. Please, we encourage you to get your COVID-19 vaccination. We have Pfizer, we have Moderna, we even have J&J. So the preference is not a problem for us. Also, you would, if you are over the age of 18, you will receive a $25 cash card, whether you're receiving the vaccination or you're transporting someone to receive the vaccination, because living in a large rural county, transportation has been a barrier for many, many years. So that is something that we're really trying to address, when we're looking at the inequities and the barriers from people receiving the vaccination. Also, we're having a community vaccination event this Saturday, actually, June 26th. We're having it at Gill's Hotel in Reidsville, North Carolina, from 10 to 2, I do believe. I'm going to share this information with Natalie and Perla, and so they can spread it out. I don't have the information in front of me. Unfortunately, there's so much going on, but I just don't want to share the wrong information. But I just want you all to be aware that we have that vaccination going on, and that in there you can receive your vaccination if you qualify, the $25 gift card or cash card, and just find a lot about the resources, whether it's COVID involved or whatever. Just the resources here in Rockingham County. To piggyback on that, on July 10th, we're having a Bring Summer Back community event at Freedom Park in Eden, North Carolina. There, we will also be providing the free COVID vaccinations, the $25 cash cards while supplies last, even the Disability Aging and Transit, a Rockingham County organization, will provide free bus rides to the event at Freedom Park in Eden. But this is limited to residents or people in Eden. And we're so grateful they are just join our efforts, and just come on to, assist us with this major endeavor that I feel like we all need to come together to do. So please, I encourage you, please, I ask everyone that's on the panel, encourage everyone that has access to this flyer to distribute it to us. And as Dr. Barahona had mentioned before, yes, you do not have to have an appointment to come to Rockingham County Department of Public Health to get the vaccination, because we offer a variety of different services. So if you come on a Monday because you have an appointment for one thing, yet we're offering these COVID vaccinations on Thursdays and Fridays, you can still receive your vaccination and still get the incentivized gift from the state of North Carolina. So if anyone has any questions at all, feel free to give me a call. My number is 336-342-8150. I have a very long email address, but it will be shared. So if you have any questions whatsoever about upcoming events, any fears that needs to be dispelled, anything that you need for me to share from our organization and regarding our community and our community partners, please give me a call.
Bueno, yo quiero tomar este momento para agradecer a todas las personas.
I would like to take this moment to thank everyone who attended, everybody who listened tonight, and I would like to leave you a message that I hope has helped with the fears that there may be around the COVID-19 vaccine. Please get the vaccine and help us to debunk the myths and the fears so that we have success in eliminating this pandemic. Thank you. Thank you so much to you, Doctor. We know you have a busy schedule, and yet you took some time to be here with us to explain these things that are myths or facts. And thank you so much for being the voice for the Latinx community. To be able to give this aspiration to trust this coming from someone in the community. So we thank you so much for your time. We thank all of our associates who were able to make this event possible. And we are very proud that we got together from different organizations to be able to give this information to the Latinx community and for the community of color. We would like to offer anyone some space to say something before we finish here. If someone would like to say anything. No? Okay. Well, I hope everybody has a very nice evening and hope to see you at the events in the future. Thank you so much.
Thank you. Great job.
Thank you, Dr.
It is an honor for me to participate of this event. How a great, awesome job you guys are doing. Thank you so much. Thank you for thinking of me.
Thank you.
Good night.
Thank you, Dr. Barahona.